I'm Dr. Lora Shahine. Welcome to my YouTube channel. Today, we're going to talk about pregnancy after miscarriage. This can be a tough time for many of you, and I'm here to help. I'm Dr. Lora Shahine. I'm a reproductive endocrinologist with over 15 years experience helping people build their families and helping people through miscarriage and disappointment and pregnancy after miscarriage. And this is a very difficult time for a lot of you, and I am here to help. Story time. When I first started taking care of my own fertility patients when I was a fellow at Stanford University, I got so much joy in calling positive pregnancy tests. And I used to call the patients and get so excited hearing the excitement on the other end of the phone. And I remember one phone call very, very clearly. I called and I said, I'm so excited. The pregnancy test is positive. The transfer was successful. You're well on your way to building your family. And it was dead silence. And I was like, hello, are you there? And this deep sigh on the other end. And she said, oh, Dr. Shahine, thank you so much, but this is just the beginning. And I took a deep breath and I just, was like, okay, this is what we're going to do next, the next steps. But when I hung up and I was really thinking about it, I realized this person had been through 4 miscarriages. She had seen a positive pregnancy test before. And for her, it had always ended in disappointment. And that was a really important learning experience for me as a provider and a caregiver. At that point in my career, I hadn't started trying on my own. And I just, I learned a lot in being my own fertility patient and kind of the ups and downs. But that was a real learning opportunity for me. And it's a really difficult process to try again after disappointment. I mean, infertility, miscarriage, failed embryo transfers, negative pregnancy tests, it is all grief. It's all lost time. It's all due dates that you are expecting at a certain time. If you have a child and you're trying to add to your family, the siblings are starting to get further and further apart. It brings up emotions of self-doubt and worry. And it is just a really different experience for people who are pregnant after such disappointment and after the grief of miscarriage. When we're pregnant, society expects us to be so happy and full of bliss. And isn't it magical? And shouldn't you feel just amazed? And, you're glowing in your pregnancy. And like, how did you tell your partner? How did you tell your family? How did you tell your friends? Are you going to do a gender reveal party? I mean, all these things, just a lot of buildup, baby showers, etc. And when you are pregnant and you've had a miscarriage before, you may feel like you're just waiting for something bad to happen. You're waiting for the other shoe to drop. You're waiting for something to go wrong. There are so many emotions, and it's important to understand that you may feel them and to not blame yourself for feeling them. You could feel anger that you're not feeling completely happy all the time. You can have fear every time you go to the bathroom. You're worried about wiping and seeing signs of a miscarriage. You can feel significant anxiety. There can be lots of triggers that come up. If you have been struggling to get pregnant for a long time or doing treatments or had miscarriages, there can be triggers that have been built into you that are still there. So you can be pregnant and expecting a baby, but still go to the grocery store and see another woman who's pregnant and feel that twinge of guilt. And then you're like, oh, wait, I'm pregnant too. You can see an advertisement on the TV for a pregnancy test and just get triggered and kind of go back to that place where you just never, wondered if you were going to be pregnant yourself. Part of being pregnant is medical checkups and going to the clinic and getting tests. And if you've had a miscarriage before, there's a real chance that you have gotten very, very bad news in the clinic. So even just pulling into the parking lot can be triggering. Waiting in the waiting room, waiting for that first ultrasound or any ultrasound. If you've had a miscarriage, you could take you right back to that place where the ultrasonographer or the doctor said, "I'm so sorry, but there's no heartbeat." And you can literally be just holding your breath until you know that everything's okay that time. And you can feel a little bit of a sense of relief, but also a little bit of dread. You can question every single symptom that comes along. Sometimes people feel very comforted when they're feeling bad. Oh, I'm nauseated. I feel like crap. I'm having significant cravings. Okay, well, at least the pregnancy is okay, because when the hormone levels are high, people often have negative feelings or feeling nauseated, or they call it morning sickness, but it can be all day. I want to reassure you that those symptoms can come and go. And the symptoms, although it's kind of a wives' tale or a common sort of reassurance that, oh, if the worse you feel, the better and stronger the pregnancy is. So that's actually not true. Every person is different. Every pregnancy is different. And some people can have a perfectly successful pregnancy and baby and have no morning sickness, or the symptoms can kind of come and go. But if you are feeling comforted by having those symptoms and they go away, you can have a huge sense of dread until you can sort of check on things in some way. So I'm just really want you to realize that all of these feelings are valid and common, and it's normal to have a significant amount of fear and anxiety and negative emotions when you're pregnant if you have had disappointment and miscarriage in the past. And so it's important to realize that these feelings can come and find ways to cope. The first step is just recognizing, like, hey, it's okay that I feel this way. This is actually kind of normal. I hate the word normal. I mean, who gets to tell us what is normal? But it is common for people to be nervous in pregnancy. And so I want you to realize that you are not alone if you're feeling this way. And I want you to seek help if it's impacting you, or the negative thoughts are more common than positive thoughts, or it's impacting your ability to do your everyday activities. I am a physician and I do care for my own patients, but these YouTube videos are not medical advice. If you are having these symptoms, you should reach out for help. And so here are some things that can help. There is nothing like one-on-one therapy. There are counselors and therapists out there that specialize in caring for people going through infertility, history of miscarriage, pregnancy, after miscarriage, and after infertility. You can find those people and find that right therapist for you. Some people find a lot of joy and comfort in surrounding themselves with people that understand this, that get it. And there are group therapy sessions that might be really helpful. A wonderful national nonprofit run by patients for patients is called resolve.org. And through that organization and that website, you can find groups that used to meet in person, but now after COVID, we found a way to meet online. And you can find people either in your community or across the country that can meet and share and comfort each other in the setting of a group therapy session. You can also find group sessions in your own community, sometimes through hospitals, specifically women's and children's hospitals, or churches and other community centers. And a lot of churches will have these wonderful support networks and systems, and they're not faith-based necessarily. You don't necessarily have to be a member of the church to go and find that comfort. And so just ask if you find one advertised, just see if that sounds right for you. So therapy, whether it's one-on-one therapy or group therapy, is just absolutely wonderful. Taking really good care of yourself and finding joy, whether it's time alone, time to read, TV show that you've been wanting to spend time with, walking, hiking, trying a new recipe, gardening, organizing that closet that you've kind of been waiting to do. These are a little bit of distractions, maybe finding joy, self-care, distraction, therapy. Finding that support is really, really important. And unfortunately, close friends and family Although they might be trying to help, sometimes they don't provide the support that we need. Sometimes people that are close to you want you to forget those negative emotions, to kind of don't validate you, sort of say, oh, you're fine. You're pregnant now. Everything's fine. Stop worrying. Stop thinking about it. Just relax. Maybe they're trying to be supportive, but this is something that's really important to pay attention to and to take good care of yourself. So, being pregnant after miscarriage, it's normal to feel a lot of emotions, both good and bad. Find support and take really good care of yourself along the journey. Two resources that I find are really helpful in understanding the emotions that come with pregnancy after miscarriage and infertility. One is called Infertility and PTSD, The Uncharted Storm by Joanna Flemons. So PTSD, post-traumatic stress disorder. Joanna really goes through a lot of the common triggers that we can have when we're pregnant after a miscarriage, the common feelings, the ups and downs, and some solid ways to find the support that you need through this process. Another wonderful resource written by a dear friend of mine and an incredibly respected colleague, Dr. Alice Domar, is called Finding Calm for the Expectant Mom. This is a wonderful resource, again, going through a lot of the emotions and difficulties and anxieties of being pregnant after miscarriage and infertility. And Dr. Domar really goes through some tools and other wonderful options to helping decrease that stress and really help you find that support. I hope this video was helpful. If you are pregnant and feeling anxious, you are not alone. If you are struggling with infertility and have had a miscarriage and you're nervous about getting pregnant again because of these feelings, that is normal. I hope this was helpful. Please like this video if this was helpful for you. Comment with any questions that you have and subscribe so that you can get notifications when I have more videos. Take care and stick around for more educational videos.